So if it is serious illness, so they have to refer the patient up to the top, like to the referral hospital, provincial hospital, and to the national hospital. So this one, they have a minimal package of activities, and this one, they have CPA 1 and sometimes can be CPA 2. And the provincial hospital, they have CPA 2 and sometimes can be CPA 3. It depends on the development in the province. And the national hospital, they have CPA 3 included with the specialized services. Okay, so we have 7 national hospitals right here, and we have some other educational centers right here. So I'm going to show you how it looks like the hospital in Cambodia. So this is the Khmer Soviet Friendship Hospital, where our professor is the deputy director of Khmer Soviet Friendship Hospital. It's quite big, and it's the biggest hospital in Phnom Penh. And this is the Calmet Hospital, and this is the National Pediatric Hospital. This is the Ongdung Hospital, and this is the Kantabopa Hospital, the pediatric hospital as well. So, and this is the Prakosama Hospital. So that is the biggest hospitals in Phnom Penh. And the provincial hospitals. So Cambodia, we have 25 provinces and the municipality, and we have other 4 educational centers. So this is how provincial referral hospital it looks like. This is the health centers. I just want to share how it looks like. It's very small if compared to the developed country. So this is the medical school. We have 6 medical schools in Cambodia. So this is the the University of Health Sciences, which they take curriculum in French literature. And my university is International University, which is taking in English. And this is the Institute of Health Sciences of Cambodia Royal Armed Force. They're also taking in French curriculum as well. And this is the University of Puti Sastra, and this is the Northern University. And about myself, before I volunteer for the CCMA, I have been doing lots and lots of volunteering job and the charity. So actually, I have been living in the orphanage for 10 years. So I was from nothing into something nowadays. So some people they just volunteer when they have too much, they have too plenty, so that's why they share what is left over. But at the time, I had nothing in my pocket. I didn't even earn a single dollar per day. So, but anyway, the volunteering, it doesn't mean just from money, but it's from your time, from your heart, from your sacrifices. So I had been volunteering with the translation, interpretation, and helping the medical mobile clinics to the villages. So I've been in many medical teams from Australia, from Canada, from the United States, from Korea, and from China as well. So I've been doing some volunteering work in Prakosama Hospital, helping the orthopedics patients, which they have traumas on their feet, they cannot move, so they might have bed sore because they're staying in bed for just too long. So I just help with cleaning their head. So it's just only a volunteering work. Sorry. This is how we operate it. And I have been, this is the activities that I have been as a volunteer for the medical teams. So firstly, I learned just only into help, like a translation, but afterwards they teaching us how to operate by itself because I'm a medical student, so I have to learn in connecting with the patients and under the supervision by the doctors. Okay, so as we are still students, but we still can join in the medical teams to help in having the community outreach. So in Cambodia, we cannot say it is a very poor country because some part people are very rich and some part people are very poor. But generally, people are very poor. If you go to the rural and remote areas, you will feel in compassion and very pitiful. So there are lots of people who needs the medical care. So the medical teams in Cambodia are very big, and right now we have 4 big medical teams, which all the medical students can join and volunteer for the community outreach. And so after that, other than just medical charity, I also do my personal charity, like helping the poor kids. Like we bought the new shoes for them, and they are living in the rubbish slums. So actually, doing the charity is helping me myself to count my blessing rather than just counting my suffering. So actually, I feel that myself is very bad, and I met lots of bad situations in life. But anyway, when I see people's getting worse and they have nowhere to complain about their pains, so it helps to understand the feeling, so I can count my blessing more than suffering. So this is the computer room that I asked for the sponsorship to build it in my village, and I can help these little kids to learn the computer. Sometimes the kids in the rural area, they don't even know the word computer, what it looks like and what it is. So it is the toys and stationeries and clothes we distributed to the village. Okay, so after that, I don't have lots of photos to show, no time for it. And before I did many things, and then when I met the CCMA, I just fell in love because we have the same heart in helping the poor people. So this is the CCMA. I have helped the CCMA just last year, but the CCMA has been established in Cambodia since September 2016. This is our location, the office in Phnom Penh. And we have lots of functions in outreach to the people in Cambodia. The CCMA also helping the students and the volunteer with academic and professional skills, improve the quality of education, and also helping the physicians with other equipments and conferences, providing the quality equipments to the hospitals and helping to enhance the communication platform and support the physician with counseling, medical care, and treatment, patients care. And we have telemedicines and video conferencing as well. And the various mobile clinics, like we have done lots of mobile clinics to the rural area. And we also opened the free access granted all healthcare providers in Cambodia. So these are the activity we did and we are doing in Cambodia. We did lots of international conferences and also the medical conference. This is the medical conference in International University, which is my university. So it is on the 7th July 2016, and this is on the 8th of July 2016, and this is the professor is the director of Khmer Soviet Friendship Hospital, and this is Dr. Shet Chun. Okay, and this is the medical conference at the CJCC. CJCC stands for Cambodia Japanese Cooperation Center. Okay, and the conference at the UMP in Vietnam, just lately, 16 August 2018. And this is the medical conference in Khmer Soviet Friendship Hospital, where our professor comes from. Okay, and this is the medical conference at the International University in my